Former Secretary General of the United Nations, Ban Ki-moon, said that sustainable development is the path to the future we all want. It creates a framework for real economic growth and achieving social justice. Welcome to Gombe's transformative journey. We have a packed episode for you this week. We'll start off with reviewing major activities and events that occurred in Gombe during the past week. And after that, in our sector in focus, we'll be bringing you an interesting conversation on the policy drive and thrust of the Inuayaya administration to create economic growth and inclusive wealth, which is going to transform Gombe into a true jewel in the savannah. Sit back and relax as we take this transformative drive together.
One of the primary reasons why we decided to put up the Muhammadu Buhari Industrial Park close to that in Kwada is because there is availability of power. Without power, no industry or industrial activity will thrive successfully. Neither Delta power plants, especially those that are gas-based in the south, are not doing enough. So, in a bid to cover that gap, they approached states like Gombe and some other states, and we've already given them land close equally to the industrial park. Their mission is to produce 250 megawatts. So 250 plus what is already available in terms of the hydro that is available, we'll be talking about 300 megawatts available right at the doorstep of industries that are operating in Gombe.
The Muhammadu Buhari Park is not only a park, it's been designated as an export processing zone. That application is still with the federal government, and very soon it will be designated as one of the export processing zones in the country.
We've divided the Muhammadu Buhari Industrial Park into 3 phases. The first phase is 364 hectares, which is being done now. It has reached 85% completion. And our plan is that by December it will have been completed, 100%. And the second phase is where we have already been talking and we've reached a very far distance with the Ministry of Finance and the Federal Ministry of Agriculture, with a view to making it an agricultural hub, that is agri-processing zone.
It is also being designated as one of the special agro-processing zones that has been established in conjunction with the African Development Bank.
So we are calling investors to come and see what we have, see what we have on ground. So we've given them the what we have on ground, and the financial institutions ready to organize finances for them in case they want to invest at the industrial park.
Hundreds of investors have expressed interest to operate from the Dagon Oil Industrial Park, and many more are willing.
Seeing investors that have shown an interest in moving into the industrial park with clear written requests for the kind of incentives and concessions that they want. So our job now is just to go and negotiate those concessions and see how we can get those concessions approved for them.
This industrial park, since the commencement of the construction, a lot of local companies have started thinking of forward integration. Some have started thinking, okay, look, if we go and do backward integration, then we can now come and increase our capacity. Some are even at, well, we don't need to do forward or backward, but we will improve our capacity, we will employ more people, we will provide more income to the families, and then there will be a lot of tax revenue that will be going to the state.
Welcome to the program today. This is Gombe's transformative journey. I have with me here the Honorable Commissioner for Health in Gombe State, Dr. Abu Dairu. He has several decades of experience in the health sector, both as a physician and an administrator. Thank you, Honorable Commissioner, for joining us on the program today.
It's my pleasure. Thank you so much.
Okay, I'll start with a very obvious question. When Governor Inuaya came on board as governor of Gombe State, one of his first major projects in the health sector is the renovation of the state specialist hospital and the building of brand new structures, both for the GOPD and the accident and emergency section, and also bringing in fresh doctors into this very critical healthcare center. What was the reason for this?
You see, several years ago, when Gombe State was created, we came in from Bauchi, and the specialist hospital then was called a general hospital in Gombe. And it was the only general hospital. I mean, Kaltungo, Bajoga, other ones were there, but it has the highest number of patients coming in and facility. Now, we want to start internship training. For 26 years, the doctors that came from Gombe State had to go elsewhere to do housemanship training. So we now said, let us improve the specialist hospital to bear the name specialist, where you would have the accident and emergency unit, the medical ward, the surgical unit, the pediatrics unit, the obstetrics and gynecology. All these specialties have to come in, and then recruit consultants. And we have a medical school, the Gombe State University. The College of Medicine is there, and we're producing doctors. And these doctors need a place to do their internship, which is compulsory before they are licensed to practice. So to get that, His Excellency said, we need to have a standard facility that will, one, provide training, two, improve service delivery for the people of Gombe State. And that was the genesis. So the accident and emergency, is a triad. And Gombe is on a highway connecting Yola, connecting Bauchi, connecting Bono. We have a lot of accident cases. So when you need to have a triad where you come and solve these cases, then refer and then attend to them. So we now said, let us have a befitting A&E unit, story building with office structure, conference rooms, and consulting rooms. Even side laboratories, side radiology units, side theater, minor theater. Then when you sort them out, you now take them to appropriate units. This is the reason why we did that.
I remember 2019 clearly, when the governor came on board after the elections.
Yeah.
There was a major accident around the bypass in Gombe. And when we went to the hospital, there was no, the electricity was off. Then the governor went there for his inspection and was asking the medical director that, why is it that there was no light? And he said there was no diesel.
There was no diesel.
And he said, I think some of these issues of electricity, issues of manpower, they've been addressed by this administration.
Absolutely. The first thing, you remember immediately he was sworn in as a governor. From the stadium, his first point of call was the specialist hospital because it has high priority for health. I'll come to talk about that. Now, from the stadium, he came to the hospital. Now he said, why is it that we're operating? He replaced those obsolete equipments. He replaced the generator. He also introduced solar system. Now, if you go to essential areas, meaning labor room, theater, laboratory, they're all on solar.
Beautiful. So in Gombe, you would say that COVID was a challenge, but it came with a lot of benefits.
Absolutely. There were so many things we got as a result of COVID when hitherto were not there. Like the isolation centers, the emergency, the ICUs. ICU was not this thing. Now we got training of staff. We also got infrastructure. We also got additional hands.
So now let's talk about some of the infrastructure that has sprung up since then. I know that a general hospital is being built or being remodeled in each of the central zones, and so much investment has gone into this secondary.
You see, the concept of picking at least one general hospital to be improved to the same status as the specialist hospital in Gombe was referral system. Okay. Now we have one in Kaltungo. Now, all the PHCs, we are linking the primary health care centers to the general hospital, so that we have SOPs. Everybody has his limit. At the primary health care, at the maternity, at the dispensary, into the maternity, into the primary health care level. Now, if you don't have a place where you would refer, then there will be a problem. And the reaction time, a woman with a ruptured uterus from a primary health center, I mean, if you say you have to bring her to Gombe, it will be, so if you're in Shangom, we quickly take her to Kaltungo. So we now pick Kaltungo. Kaltungo, by the way, is the oldest general hospital in Gombe, one of the since missionaries to Sudan Interior Mission. So it has a very good reputation, but has been abandoned over time. Then His Excellency the Governor thought it wise to say, okay, let's have Kaltungo General Hospital, improve it to the standard of the specialist hospital. Then let's take another one in Gombe Central. The one in Gombe Central, we pick Kumo and Ako and Yamal Tudeba forms Gombe Central. Now we pick General Hospital Kumo. The Kumo Hospital was sinking. It was in a place where it's marshy and the whole building was sinking and the structures were obsolete, equipment obsolete, not suitable for as a hospital. So what we said was, we're recommending demolishing the whole structure and clear the space. They have to come and do a soil testing, the engineers, to see why the building was sinking. Now we built a brand new hospital in Kuba, 200 bed space. Not only just the idea of a hospital, we improved the sizes of the theater. We also improved, we brought in the public health unit. We also have the physiotherapy unit and the biomedical engineering unit. Okay. Hitherto, our hospitals do not have these facilities. Any equipment that got faulty, just thrown away. But now we can calibrate, not just faulty. We need to calibrate, we repair, and we need to calibrate equipment and instruments in order to function more effectively. So if you have a biomedical engineer, you repair those that are getting this in, and you continuously calibrate this equipment for better performance. So a biomedical engineering unit is put in place, a physiotherapy center. We have a special public health unit where we have immunization. We have also the nutrition unit, because with cases of malnutrition, stunting, and we are in partnership with the World Bank through one project called RIM project. We have Solina and Head. They are giving macro and micronutrients to mothers before pregnancy, during pregnancy, and shortly after delivery. Then the children, on weaning, we identify them and we have a way to assess them into this, and we give. So the case of stunting has gone over these 3-4 years. Oh, really? And because if you see the survey that was done in the Northeast, Gombe, a few local governments in Gombe, 3 or 4, have high incidence of stunting because of severe malnutrition. And the malnutrition is sometimes intrauterine, yes, before even the child, because the mother too is malnourished, and the child there becomes malnourished before it's even born. And then during weaning, because we have some traditional, social, cultural behaviors that make children suffer, and that direction. Now, health education was introduced, and we are perfect, we are good to go. With the improvement we had at the specialist hospital in Gombe, for resident for internship. Now we got accreditation team came to Gombe. Before, our doctors have to go to Lagos or Zaria or abroad to become consultants. So the residency program has commenced as a result of infrastructural upgrade of the hospital and the availability of relevant consultants to supervise residents. Okay. Now, the specialist hospital, Bauchi, we now have to bring in additional equipment in specialized areas to take care of the residency training. Now, I'm happy to tell you that we're doing residency in family medicine, in obstetrics and gynecology, and medicine. So in the full departments, these 3 departments, we're doing residency program. Now, by next year, we want to invite the surgical team to see how we can do residency in surgery and orthopedics. Then we also do in laboratory medicine. We want to start hematology, pathology, and other related areas.
Now, my next question is the primary health care centers across the state. New primary health care centers were built. Some of them had to be manned by fresh personnel. Then I know that lots of investment went into them. Can you tell me the status?
You see, when we first came in, we believed that medical care, the first point of contact for the common man is the primary health care unit before he comes into the secondary facility. So we now said we reject the primary health care. There was primary health care development agency, but it was comatose. So we now reject it by bringing in, a part of the policy was, okay, let's establish health services management board. Let's reject, that's government policy on day one. Reject the primary health care, establish Gombe contributory health scheme and drug management agency. And we started taking them one by one. Now with the primary health care development agency, we put in the new management for the primary health care development agency. And we started by considering at least one PHC per ward. But some PHC, some local governments like Kwame got over 10 because there was a special intervention partnership between UNICEF and Gombe State government, and we took all the PHCs and maternities in Kwame local government. Then in other LGS, 2, 3, but no ward that got less than 1 at least. We reject them. And what we did there is not just infrastructure. We retrained the staff. We brought in consumables and commodities, drugs. We put in solar. We put in water supply, borehole that is motorized by solar. Then established the nutrition unit. Like I said, we were working to reduce nutritional deficiencies among the communities.
Out-of-pocket expense is
very, very high.
It's very difficult. So I know that there's insurance scheme that came up. Can you just shed light on this?
Yes. In Gombe State, when the idea of out-of-pocket expenses became a problem, Gombe State government now established by law the Gombe State Health Contributory Scheme, Go Health. A bill was established or was sent to the State Assembly. A law was promulgated for the establishment, and the board was formed and the management, and we started into action. The whole idea is, if we want to achieve universal health coverage, the only way you guarantee access to the common man is through health insurance. So we try to now start massive enlightenment because people are used to free medication. Now, because you have to give some capitation, you have to give some equity as well. So we started with the civil servants. We went and started discussing with the civil servants. We were with the Nigerian labor. We told them the advantage. We told them, look, you're giving only 3% of your salary monthly. And 3%, that will give you access yourself and your family members. Husband, wife, 4 children under the program. Now, we registered all the civil servants, except the local government staff. Then their salary structure was still in this. So just last 2 months ago, when the salary structure was agreed upon, all the local government staff have been now on, we've started their registration. We have what we call formal sector, where we have the civil servants. Then the informal sector, where we have the trader, the farmer, the blacksmith, the achaba man, and the keke nape man, the market woman, the herdsmen, everybody. Then we have under the basic healthcare contributory fund, we also have the vulnerables. Those vulnerables are registered free.
Totally free.
Totally free.
That's the physically challenged.
The physically challenged, the aged, and those with some that are poorest of the poor. So we have a registry. We have a registry where you identify those people, and we registered about 48,000 civil servants, and we registered vulnerable groups about 5,000, and then that time the IDPs. You remember that time the IDPs were still active. Yes. Those people from Borno, from Yobe, because of the insurgency, they were still in Gombe. We considered them because they're IDPs. Then we continued. Now the informal sector, that's our challenge. People are used to free drugs and free this thing. So we are now working hard. We are making mass campaign, enlightenment to tell the people. Now the testimonies from the beneficiaries are making them rush to register.
Quickly, let's talk about the law that is in the works now. The medical consumable agency.
The drug management agency.
What exactly is this about? And in a nutshell, what are the benefits that the people should be expecting?
You see, when we saw a lot of out-of-stock syndrome in our facilities, lot of fake drugs in our facilities, not only in the facility, even in the state, because in the pharmacy will go to Onitsha or go to Lagos or go to bring in drugs that sometimes have expired, sometimes poor storage. We now say, let's form a drug management agency. Now, a bill was taken to the House of Assembly. They approved it, and His Excellency endorsed it. It became a law to establish drug management and consumables. Now, this will the whole idea is to have a direct contact with the manufacturers. With the establishment of the bill, there's now an executive secretary. There's a board in place already. His Excellency has approved the appointment of an executive secretary, has established the board. So the next way for us is to sign an MOU with PG Man, drug manufacturers. Now, we have trailer loads, and the condition is you have to have adequate warehouse with appropriate storage. You remember I was telling you, if drugs are not stored properly, they become inefficient. They lose efficacy, and when you take them, you're not going to get the required result. So we have to, first of all, part of the condition, construct huge warehouses with a conducive environment for storage, counters, air conditioning, computerized in and out, this is for drugs supply, the logistics and everything. Like you see, Governor Eno has a budget since we came, 2019, 7 billion or thereabout, improved to 9 billion, now 12 billion. So we have to achieve that because they said, if you want to provide health care, you must get at least 18% of the total budget in health. Then you'll be able to do that. So you must put in, then you also do partnership. You have to reach out. Now, Gombe State is in partnership with Global Fund, with Bill and Melinda Gates Foundation, with WHO, UNDP, UNFPA, UNICEF, World Bank. So that partnership enhance that. Then capacity building for staff. I want to see that every facility is having the requisite. We have the human resource for health across the globe is not this. And that's why you have this Japan. Everybody is going to Europe doing that. So in Gombe, fortunately for us, we have a medical school. Then the new school of nursing we are building at the bypass will accommodate at least 500 students at a time for every session. So this means we'll be producing the middle class member, the nurses, the midwives, then we have School of Health Technology. Then the private sector, they're not left behind. We are, but with the regulatory body, we ensure that all private health facilities, schools under this that are producing graduates for health technology, maybe medical record, lab technicians, dental technicians, pharmacy technicians, all of them, we need them.
Apparently, there's so much that is going on in the health sector in Gombe. We apparently can't cover everything, but we're grateful for your time. That has been the Honorable Commissioner for Health in Gombe State, Dr. Abu Dairu, experienced and very interesting, very intellectual, and it's been a wonderful conversation.
We have enjoyed this, the coming government that has served, or rather the agency that has served in renovating this our facility. And in fact, now it looks more better than before.
Normally, if we come here, you will find out there's no medicine, things are not the way it's supposed to be. But for now, everything is in order. The environment, water, the facilities are okay now.
The Go Health Plan that has been introduced, we, the less privileged and unemployed, feel this is a big favor done to us by God Almighty. It has helped us greatly. We don't buy, we don't sell because we are aged and battling ailments. Therefore, we have nothing to say than to thank God and Alhaji Inuwa Yahaya Umar. I was operated upon without paying a single penny. The surgical procedure was successful. We chat with them. I am working and everything is fine. I thank the governor of Gombe State.
I totally enjoyed that conversation, and I'm confident that you did too. I also hope that you've seen the true wealth and potentials that lies in Gombe. That's much we can take on this episode of Gombe's Transformative Journey. Do join us again next week for another edition. But before then, you can watch this episode and others on our YouTube platform. So we see you next time. I am Landry Adeyemi.